On this Wednesday morning, September 9, 2020, good morning. Special edition of the Bronson Health Chat for you this morning. And we're joined by Dr. Stacy Majoras, sports medicine, non-surgical physician with Bronson Sports Medicine Specialist. She serves as a team physician for high schools, universities, and professional organizations throughout Southwest Michigan, WMU, K-Wings Hockey Club, among others, and has experience in diagnosing and treating athletes and their sports-related injuries, and is also the proud mother of 4, too. Today, Dr. Majoras is with us, and we're going to talk a little bit about the importance for athletes to practice COVID-19 safety precautions on and off the field, and if they get injured, what should they do? And it's good to see you again this morning. Thanks for being with us.
Thanks so much for having me, Ken.
Thanks. What are some of the challenges athletes encounter during this unusual time we live in?
I would say the biggest challenge that our younger athletes and adolescent athletes are seeing is the lack of resources at home during COVID. And so they were not able to maintain their competition shape while they were not playing sports at school. And so now the reintroduction of sport has been difficult for some to prevent injury. We're also seeing emotional changes with our young athletes as well. Many athletes had accepted that high school football was not going to happen this fall, and now it is. So even though that seems to be very exciting and can be a very happy time for many athletes, it can also be very difficult, the lack of structure and the uncertainty of the world just weighing in on them. So we are seeing that as well with our young athletes.
So what are some of the safety precautions that athletes should be taking right now?
So they should be taking the same precautions as everyone else. They should be trying to maintain their social distance at 6 feet or longer. They should be washing their hands as much as possible. If they can't wash their hands, they should use hand sanitizer, and they should be wearing a mask when it is appropriate. We did stratify a lot of different sports in their risk profile. So sports that are more low risk, such as golf and tennis, individual sports, gymnastics, swimming, running, they can participate in activities a lot easier than, say, a sport such as football or hockey where there's a little more contact. So they should be maintaining the same protocols that everyone else is currently. And then they should be wearing the appropriate equipment. So if they have the opportunity, say in football, to wear a full face mask, or in hockey they have full bubble masks, they can partake in using those protective equipments as well.
Well, now that we're getting back into sports on the university and high school and junior high level, when Bronson athletic trainers are at practices and games and matches, what are some of the things that you do to help keep the athletes safe during this competition?
You know, Ken, our athletic trainers do what they do every day, and they are elite athletic trainers. They assess the situations, they find the possible resources that they can help the athletes, and they do everything that they can to make them safe and help them rehab. So our athletic trainers have continued to do the same great work that they always have. They are amazing role models for our young and adolescent athletes. They are doing everything that they're supposed to do from a distancing and a mask wearing standpoint. And then they're also helping us screen our athletes. So they see them on a daily basis, where as a physician, I may only see them once every couple of weeks or a couple of months. So they see them every day. And if something is going on, either not feeling well or emotionally, they can usually pick up on that. So they are just doing their job, and they're doing it a great.
Dr. Stacy Majoras is with us from Bronson Sports Medicine here on WKZO this morning. And what are some of the tips that you would give to athletes to help them prevent injury?
So again, I would say that prevention of injury hasn't really changed with COVID. The same things that they always need to do, which is maintain an excellent hydration status, eat well, get good quality sleep. If the body isn't fueled right and it's not rested, then it won't heal from those injuries. If they do end up having an injury, they should be evaluated sooner than later so that they can start the rehabilitation and get back on the field sooner as well. And then they should start doing preparation for their sport. So now that we have the ability to start working out. Our Bronson Performance Training is now open on a one-on-one basis. Athletes can get their bodies ready for their sport. And so if they haven't started playing already, such as baseball, if you're in a sport that you have time to prepare, that's your best way of preventing injury.
Are there some common injuries that you're seeing more than others right now?
I wouldn't say any more than normal, but we are seeing a lot of overuse injuries. So one big thing that happened during COVID was the lack of resources. And so people who may have done swimming or weightlifting now are doing things like running or biking and using different muscles that they're not used to doing. And then they were doing a lot of it. And so we're seeing a lot of overuse stress injuries such as tendonitis. Our youth baseball players are experiencing stress from growth plate injuries, rather. And so we are dealing with a few baseball injuries because it ramped up so quickly. And again, the lack of preparation for that sport. So just a few different things, but they're typical at this time of year.
And just kind of on a side note, and today's the day that gyms are reopening around the state of Michigan. The recommendation is that you've got to wear a mask. Do you recommend wearing masks in competition? Does that impact the athlete in any particular way? Can they still get a benefit out of it?
So that's a very hot topic right now, and I will try to be as neutral as possible when answering this question. The recommendation from many different organizations, from sport and from physicians, is that high-intensity exercise should not be performed while wearing a mask. With that being said, you have to risk stratify. So is it more important to wear a mask and prevent injury or prevent illness from COVID? Or is it more important for them to not wear the mask and decrease the risk of maybe rebreathing or having an elevation in CO2? At this point, some people would say that if it's too dangerous to play without a mask, then maybe they shouldn't be playing. However, we have done studies looking at athletes in masked prior to COVID. We do studies in the exercise physiology lab, and an elevation in CO2 may decrease some peak performance. It doesn't necessarily cause any long-term damage that we know of so far. So the best answer to that is we don't really know. We just have to follow the recommendations that are current and do what we need to do to keep everybody safe.
Yep, that's going to be the rule, at least for now. So, Dr. Majoras, if our listeners have questions about the topic this morning or need to make an appointment, have concerns about a potential injury, what should they do? Who should they contact?
Well, they can call our office at Bronson Sports Medicine Specialists at 855-618-2676, or they can go on our website at bronsonhealth.com/sportsmedicine.
Dr. Stacy Majoras has been with us, sports medicine non-surgical physician with Bronson Sports Medicine Specialists. And we wish our athletes the best, and thank you for sharing your information with us this morning.
Thanks, Ken.
Appreciate it, Don. 590 and 106.9 FM WKZO.